Let's Talk About Kidneys takes a deep dive into the chronic kidney disease patient journey. We're here to inspire meaningful conversations and to help people living with CKD gain a full understanding of their disease. Dialysis is a life-saving procedure that takes over many functions of the kidneys. It can be accessed both in dialysis centers and in your own home. Today, we are going to learn more about the types of dialysis that can be done in your own home. Welcome, Dr. McDonald. How are you today?
I'm doing well, and thank you for having me, and hello to all the podcasters out there.
Yes, we are so thrilled to have you today. We know you will bring a wealth of knowledge to this topic today, so I think the best thing to do is to kind of jump right in. We're going to be talking about dialysis and the different types and modalities. What are the different dialysis treatments done at home versus the in-center dialysis treatments?
Well, basically, I'm going to start with in-center.
Okay.
An in-center, to make it very clear, is that the patient goes to an outpatient dialysis center, hopefully close to their home. They go in, they sit down at a chair. They're in the chair for about 3.5 to 4 hours. Now, when we talk about home dialysis, there's a couple of types. One is home hemodialysis, just like in-center, but you're doing it at home. And there's also peritoneal dialysis through the belly, which is also done at home.
Okay. So before we go into the different types, first of all, they have to make the decision if they're going to do dialysis, and then which decision needs to be made on which modality.
Correct. And just really talking about whether or not the patient will do dialysis is worthy of a whole nother podcast, because there's so many decisions that come into play in terms of life decisions, life or death decisions, so to speak. So when patients go into deciding which type of dialysis, as a doctor, we want the patient to choose something that fits their lifestyle. And everybody is different. Everybody is into something. So some people are very content to do things at home. Some people are like, oh, home is the last place I want to be. I want to be with my friends, with people that I like. I want to be in-center where the nurses are there to help me. So it really depends on the patient, how they look at their life and their lifestyle.
Okay. And so can you cover what are some of the advantages of doing home hemodialysis?
Well, the biggest thing about home is that, first of all, you're in your home. And most of us look at our home as sanctuary. So you have a special area in your house. The dialysis machine is about the size of a nightstand. And as we go further in technology, they're getting smaller and smaller. They're very easy to set up. Everything is kind of self-contained. You open it and push it in, and after you've plugged it into the wall, you flip a switch. So the technology of the machine is pretty straightforward. And so once you hook yourself onto the machine, you're there for 3.5 or 4 hours at a time. You're able to interact with your children, your friends. You're able to watch TV, take a nap, get online, whatever you'd like to do. So a lot of people like being at home because it's just very comfortable and natural for them.
Okay, so you did just cover some of the advantages, but can you talk about some of the disadvantages of doing home hemodialysis?
Of course, I've had some patients that, to them, their health care, like most of us, is very private. So they don't like to be at home because people come by. Even some of their close relatives, even their adult children, they don't like them to see them in this position. And some of it is even tied up that sometimes when we're ill, people have this misconception that they're weak. And so they think, oh, people are going to see this. I've even had patients say they don't even like the delivery van with supplies to be seen at their home. So like I said, it all depends on the patient and how they look at themselves.
Okay, so privacy is definitely key to that personal decision to making that choice.
Privacy is key, but also when you talk about home dialysis, there's a certain amount of, for instance, the patients have to be comfortable sticking themselves with a needle, or as we say in doctor language, cannulating their access.
Okay.
They have to be comfortable doing that. They have to be comfortable with maybe the buzzers that go off on the machine. So there's certain things that, some people are very comfortable with and others are not.
Okay. And so we covered hemodialysis. Can we talk about some advantages of peritoneal dialysis?
Well, with peritoneal dialysis, it's very portable. For those that aren't clear, there's a catheter that's into your abdomen, that's inserted into your abdomen in surgery. The catheter comes out of the abdomen, and under sterile technique, and that meaning gloves and a mask, the exchanges, the tubing is connected to the tubing that exits the belly. The fluid goes in. It takes about 15 or 20 minutes for the fluid to be instilled.
Okay.
It sits there for about 8 hours. During that 8-hour period, you can go out, you can go to the store, go to school, go to work, come back after about 8 hours using your gloves and your mask, connect again, and drain the fluid out of your abdomen.
Okay.
So peritoneal dialysis it's not as technologically advanced, say, as the hemodialysis. There's no machine necessarily involved. But it's also easy, for instance, if you're traveling, you can throw the exchanges in the trunk of your car. If you're flying, you can put them in a suitcase. We give patients a letter for TSA. They're able to take it on the plane. It's pretty easy to deal with. There's also something we can talk about at a later time called the cycler, which is a small machine that can be used at night in place of doing those manual exchanges that I described.
Okay. And so you gave a lot of the listeners some advantages. And, I could see someone who has an active lifestyle. You just painted a perfect picture of how the advantages of peritoneal and the convenience of it. So are there any disadvantages, or where do you feel patients say are things that are troubling or that cause them a lot of frustration with doing the peritoneal dialysis?
Well, like anything in life, there's always something. And with peritoneal dialysis, some people find it to be a stumbling block that they have to use gloves and a mask. Now that we've been through COVID, masks aren't as taboo as they used to
Right.
be. But for some people, they don't like that. Other people, for instance, believe it or not, I've had patients that have like 15 cats and dogs in the
Oh,
house,
wow. Yeah.
and there are just too many germs floating around for them to do it safely. I've had patients that just they're not comfortable checking their own blood pressure, making decisions about the strength of the solution.
Okay.
Like I said, everybody's different. And so there's pluses and minuses. With peritoneal, because that catheter exits the belly, we have to be very careful about infection. So that's kind of a downside for some of the people on peritoneal
Okay.
dialysis. When we contrast to hemodialysis, some of the things, sometimes blood pressure can fall, other issues. So there's pluses and minuses to everything.
Okay. And so if you had to think about a patient that has been super successful with home hemo, can you give me an example, and also a successful patient that does peritoneal?
Well, what I like to tell my patients is the key to what you're asking me is successful. And what I find these days, not just with patients in dialysis, but I think all of us in today's society, there's a term that's going around now called calling people out of their name, which is not nice.
Right.
But when I hear patients say, "Oh, I'm so stupid, I can't do this," or, "Gosh, I'm so ugly," that's calling yourself out of your name.
Right.
So you have to have confidence. You have to believe in yourself. And if you're constantly cutting yourself down, you're not going to be good at anything. So with all of my patients, I like to give them that confidence and say, "Hey, you can do this." A lot of times I'll tell patients, if you remember when you learned how to drive,
Mhm.
you may have been
Oh, good
14 or
example.
15 or
Yeah.
16. And I can remember, just driving and the indicator and the mirror and the radio, when you're a teenager, all of these things, it seems overwhelming. But now when you get in the car and you drive, you don't think anything about these things. And the same is true, for instance, of the home dialysis modalities. With peritoneal dialysis, once you get the system down, mask, glove, you're in a room, everything's quiet, you drain the fluid out of your belly, you put it back in. Or with home dialysis with peritoneal on the cycler, getting towards bedtime, you hook up to the cycler, you go to bed. Sometimes the alarms go off, you know what to do. Um, then you're comfortable. When it comes to hemodialysis, home hemo, it's the same thing.
Okay.
Once you learn and get your systems down, it's very comfortable. And I just want to mention, too, to the listeners, when you do peritoneal dialysis, there's at least a 5 to 7 day training period, one-on-one with a nurse.
Okay.
And then all of our patients, we tell them, somebody's always available for a phone call, even in the middle of the night, the nurse or the doctor. With home hemodialysis, because of the technology associated with the machine, there's a 6-week one-on-one training program with a nurse. And it sounds like, oh my God, 6
Right.
weeks. But if you think about it, you have to learn how to cleanse your access, how to place your needles, how to set up the machine.
Okay.
We like there to be another family member or an adult that's with you. They don't have to be there for the duration of the 6 weeks, but they can come in and learn the high points. So, for instance, if you don't feel well or something's going on, they can assist the patient.
Okay, and so that's one of the questions that a lot of patients will have because it's a community. Even though earlier you talked about some patients and their privacy, there has to be family members that are trained or informed because if there's a worst case scenario. So talk to us a little bit about the training that family members receive.
Well, with peritoneal dialysis, we like to have the patient, and if there is an adult with them also, usually a spouse,
Okay.
because that way that person can give support to the patient. Sometimes the patients are kind of, they don't feel well, they're starting dialysis, they're a little weak. They're going to need help lifting some of the exchanges or maybe putting the dressing on their abdomen, things like that.
Okay.
So it's nice to have that extra person there. With hemodialysis, it's the same thing. For instance, the patient is in their chair, hooked to the machine for about 3.5, 4 hours. The family member may need to bring them dinner, may need to get something for them, or may need to help them troubleshoot the machine. So we like to have somebody there. On the other hand, one of the things we see particularly with home hemodialysis is caretaker burnout. And we see that not just with dialysis, but other chronic illnesses and the caretakers. But sometimes it can, and I've seen situations where it's almost more stressful for the
For the
caretaker than
caretaker,
it is for the
interesting.
patient.
Very interesting.
So that way we like the caretaker to realize that, we understand what you're going through. The nurses sometimes will even orchestrate what we call a break sometimes. So the caretaker almost gets a vacation where we'll bring the patient in center, or with peritoneal dialysis, we'll bring them to the peritoneal office, let them sit there and dialyze during the day so the caretaker can get a breather.
Okay.
And so you really have to have your hand on the pulse of the relationship between the patient and their caretaker too.
Okay, so one thing I think we should kind of circle back on, let's break down the time frame for home hemodialysis, and then we'll talk about the time frame for peritoneal dialysis that's done at home. So let's talk about home hemo. How long is the training? And then once you are trained, how long is that process to dialyze?
Well, let's just back up to, let's say, before the patient starts dialysis. You're going to your doctor's office. You've had the training that you're approaching dialysis. A lot of these patients have also applied for transplant, and they're waiting for transplant. So what we will do is arrange for access, and that's usually a couple of months, 2 to 3 months prior to starting dialysis. Once all the labs are in, the access is felt to be ready to be used. We usually have the patient dialyze in center just for a week or two to make sure everything goes well. Then they will go transition to a training period. Usually it's an office associated with the outpatient hemo unit,
Okay.
where they will start their one-on-one training with the nurse. During that time when they start, the technician and the nurse will go to the patient's home to make sure the home is set up properly, finding the right spot, making sure the electrical outlet is working properly.
Okay.
They have access to a water supply. So once all of that looks good, there's a green light, then the patient starts their training for hemodialysis at home. And generally that's a 6-week period, sometimes a little bit less, sometimes a little bit more. They start on their own, and like they said, it's not like we train you and throw you out to the wolves.
Right.
The nurses are there for support, and the doctors are there also. Even after doing home hemo, you need to come into the office to see the doctor once a month, and at that time we look at the labs, examine you, all of those things. So even though you're doing dialysis at home, you
still
do
get
go
that
to see your
follow-up.
physician
Okay.
at least once a month.
Okay.
Now, with peritoneal dialysis, it's the same situation when we know in the office the patient's ready to start. They get their catheter inserted, and usually we like at least 2 weeks for that catheter to be planted by the surgeon before it's used. Once it's inserted by the surgeon, we'll have the patient once a week go to the peritoneal center to flush the catheter to make sure it's working properly. After about 2 weeks, then they can start their training.
Okay.
Once their training is finished, the same situation. They do their exchanges at home, call for any questions. The nurse and the technician have already gone out to the home to make sure everything is okay.
Okay.
Because believe it or not, this is home dialysis. Some of our patients don't have a home. We got to see what's going on.
Right.
So once they do their training, they're dialyzing successfully at home. They still need to come in once a month to get labs drawn and once a month to see the doctor.
Okay. All right. I know you mentioned that the equipment is fairly small, and is there anything that goes on in the home environment evaluation that would prevent a patient from being a candidate for either type of home dialysis?
Believe it or not, one of the things that we've seen, and as I said, we take for granted, we have people these days that were living in like those public storage places.
Wow.
So that's not a home. So we can't do home dialysis when you don't have a home. And unfortunately, with the way things are now, housing, et cetera, sometimes that happens, or we have people that are essentially homeless. So obviously, you can't do home dialysis. We like to look at the home for peritoneal dialysis or home hemo to make sure it's clean, because we've all seen the show on TV called Hoarders. There are some people that it's just not going to work. So those are the contraindications that are definite. Sometimes we'll go look at a home and say, listen, you've got to clean these things up. You've got to have a better area, clean out an area in your home so we have a place for the supplies and or the hemodialysis machine.
Okay. And so if a patient started home hemo or home peritoneal, and then for whatever reason they decide, or the medical professionals decide, that it's no longer a viable option, can you walk us through that and how that transfers them back to, I'll let you go ahead and take that.
Sure. Well, again, remember that we like to tell patients this is supposed to fit your lifestyle. You're not locked in. Now, though there are some medical situations where, for instance, you're on hemodialysis, you can't go to peritoneal or vice versa. Those are minimal. But for the most part, we like to say, hey, are you comfortable? Is this working for you? If it isn't, you've got to communicate this to your healthcare team, because you're not locked in. We like to give you options. And a lot of times, just think about it. We might go buy that red car off the lot. After a week, you can't stand it. So you have to do something different. So we like patients to understand you do have the ability to change your mind.
I think that's a great point to just kind of take a breather, and for anyone that's listening and, feel overwhelmed or think that dialysis is just very complicated. I think you've done a good job of just kind of painting the picture and basically making that point that if home hemo or home peritoneal doesn't work out, they still have that support of in-center. And so with that support, is there 24-hour support? Like, what if something happens overnight? I know someone listening may have that type of question. So can you discuss that?
Sure. And again, everybody has these insecurities, and we all worry about things like that. With home hemodialysis, you have this machine that's pretty sophisticated. And a lot of times what will happen at night is the buzzers will go off. You'll go through your troubleshooting. There is an 800 number that the patients can call for help with that, and there's someone available 24 hours a day. In addition to that, if there's a medical issue, my blood pressure's low, something's wrong, the nurse and the doctor are also on call. So you're not out there by yourself, so to speak. That's true of peritoneal dialysis. It's also true of hemodialysis.
Okay. So we were discussing earlier about having too many animals and how that can kind of taint the home environment. So what if someone has, say, a small or large dog, or maybe a dog and a cat? for those people that are listening and can't even imagine their lives. 'Cause sometimes animals are support care
Right,
animals,
right.
they
Yes.
provide people that peace. So would that eliminate someone from?
No, not at
Okay.
all. Now, of course, there's extremes, and I've mentioned the extreme of having so many pets, and we've all seen that on TV. We do have patients that might have a couple of dogs, couple of dogs, couple of cats. That's very common. With peritoneal dialysis and hemodialysis, a lot of times we like patients to be in a room so we can close the door if we have to. With our hemodialysis patients, they're sitting in the chair for several hours. So it's nice if Fido can, kind of come in. And we all know, our animals are like our kids. Some of our kids need to sit down.
Mhm.
Other kids are just fine. They can sit there and behave themselves. I've
Right,
had cats try to eat through a catheter and, but those kind of pets, they need to stay out of the room
right.
and let the good pets in. But for the most part, people can have their pets. You just have to make sure that they're not violating the sterile field.
Okay. And so we covered a lot today, and I know listeners are given a wealth of information. If you could leave us with maybe one or two key points for the listeners to take about dialysis, home or in center, what would that be?
I think it's a general comment. I would say you can do whatever you put your mind to. If you want to do this, you can do this. And we, as your healthcare team, are going to be there to support you. So, in the beginning, it's overwhelming for everyone. So, don't let that stop you
Good
from
advice.
taking good
Yes.
care of yourself because we want you to be successful. This is about your life. It's a chronic condition. You have to live with it. You don't live it, let it live for you.
I love that. I think we should end on that because that is a great quote for the listeners to kind of resonate within them. And if home, home peritoneal, or in center dialysis is something that they're interested in, then they can listen to this podcast and let us know if they have any questions. So,
Okay. Well, thank you so much. I
no,
hope
thank
this is
you.
helpful.
Oh,
Thank
it
you.
definitely is. Definitely is. Thanks for tuning in today. Learn more about Dallas Nephrology Associates at www.dneph.com. That's DNEPH.com. And if you found the information valuable, be sure to share with those who are impacted by chronic kidney disease.
Dallas Nephrology Associates' DNA podcast series, Let's Talk About Kidneys, is provided for general information purposes only and does not replace the need to talk with a healthcare professional about your unique situation, care, and options. Our goal is to provide you with as much information as possible so you can be as informed as possible. Reference to any specific product, service, entity, or organization does not constitute an endorsement or recommendation by DNA. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity or organization they represent. The views and opinions expressed by DNA employees, contractors, or guests are their own and do not necessarily reflect the views of DNA or any of its representatives. Some of the resources identified in the podcast are links to other websites. These other websites may have differing privacy policies from those of DNA. Please be aware that the internet sites available through these links and the material that you may find there are not under the control of DNA. DNA shall have no responsibility for the accuracy, legality, or content of the external site or subsequent links. Contact the external site for answers to questions regarding its content. The resources included or referenced in the podcast and on the website are provided simply as a service. DNA does not recommend, approve, or endorse any of the content on the linked sites. The content provided on this website and in the podcast is not medical advice and should not be used to evaluate, diagnose, treat, or correct any medical condition. The content is solely intended to educate users regarding chronic kidney disease, end-stage renal disease, ESRD, end-stage kidney disease, ESKD, and related conditions, and ESRD, ESKD treatment options. None of the information provided on this website or referenced in the podcast is substitute for contacting a healthcare professional.